Occupational safety. Healthcare personnel and workers handling waste may encounter hazards and infection risks as a result of their occupation. It is therefore necessary to prevent and control these risks. All healthcare facilities have a responsibility to ensure the occupational safety of healthcare personnel. An occupational safety program should include provision of personal protective equipment, regular health checkup of all healthcare workers, immunization, management of accidental exposure to blood and body fluids, training, and documentation. Personal protective equipment. Personal protective equipment are specialized clothing or equipment which act as barriers against infectious materials. It should be made available to all personnel who collect or handle waste. The following are to be used by all those who handle biomedical waste: cap or head cover, mask, goggles or face shield, gown, gumboots, and heavy-duty gloves. Regular health checkups. According to Biomedical Waste Management Rules 2016, all healthcare personnel, including waste handlers, must be provided a medical checkup at the time of induction and thereafter once a year. Immunization. All healthcare personnel should be immunized with hepatitis B vaccine and tetanus toxoid. Management of accidental exposure to blood and body fluids. Remember, recapping is a wrong practice. It can lead to needle stick injuries. Occupational exposures to blood and body fluids can also occur through spills and splashes into the eye or mouth. When such an occupational injury occurs, do not panic. Do not put the finger into your mouth. Do not squeeze the blood from the pricked finger. Do not apply any disinfectant. What you should do is remove gloves and place hands under running water for 5 minutes. Collect blood from the source and the exposed person and send it to the lab for HIV and hepatitis B testing. Record details of the event and its follow-up in the injury register maintained at the hospital. Start post-exposure prophylaxis for HIV preferably within 2 hours and not later than 72 hours. The exposed person must also be provided with psychological support by a counselor. Training. All healthcare personnel and waste handlers should be trained on biomedical waste management on an annual basis.